This is Scott Becker with the Becker's Healthcare, Becker Private Equity Podcast. And I'm thrilled today to be joined by Alex Carroll. Alex is with the Healthcare IT advisory firm. Talk to us a little bit about the use of broad solutions versus point solutions and what he's seeing, what trends he's seeing. Also talk about trends in leadership. Alex has a golf background, so at some point we team up to ask him a golf question. Alex, thank you so much for joining us. Can you take a moment to introduce yourself and tell us about what you do?
Absolutely. Thanks so much, Scott. My name's Alex Carroll. I am a healthcare IT advisory. So I work for SHI International based out of Somerset, New Jersey. What I do every day is help hospitals implement the right technology solutions for their business and for what they're hoping to accomplish in the future. So what I do is work with clinical and IT staff to help them advise, design, implement, and manage the solutions that they put into their technology environment that are secure, help to increase their user experience, automate their business processes, help to maximize their ROI. As I mentioned, I work for SHI International, which is the largest privately held minority women-owned business enterprise in America. So we employ over 6,000 coworkers globally, and we have 10,000 partnerships in place with vendors that help us support our customers, help us solve their business challenges, ranging from things like end-user computing to working in their enterprise data center, some multi-cloud solutions. So we're really excited about what we're doing, and I'm fortunate to work with great people in healthcare IT every day.
Well, thank you so much, Alex. And tell us a little bit about what's working in health IT today well. Give us a few examples of what's working well that people are pleased with. What's going well? Because we hear so much from big systems where there is so many different things out there being thrown at them from an IT perspective, and trying to decide what works, what doesn't work, not trying to have so many applications going. So what is going well? What do people look at and say, oh, this is going pretty well right now?
Yeah, I mean, that's a great question. I do think, obviously some of the larger OEMs, for example, Microsoft, Cisco, Dell, that's where those companies are really tried and true. And I think, when you speak with a lot of healthcare advisories, they typically will say, if you go with one of those vendors or a well-known vendor, you're never going to get fired as a result of that. So I think, kind of sticking with what's tried and true. But I think one of the major things that I'm noticing in my everyday conversations with healthcare IT leaders is, the increased focus on cybersecurity. I mean, the reality is with healthcare organizations, they're probably more vulnerable to cyber attacks due to, patients' PHI, their financial information, and therefore they become the real primary targets of cyber criminals. So I think, healthcare leaders that focus on cybersecurity and embed that not just as keeping security separate from IT, but ingraining it in everything that you do. I think that's where a lot of healthcare organizations are seeing more success, more stability, less vulnerability. So that's where we're focused. That's where a lot of our customers are focused, and we try to meet them where they are.
And talk to us about this. I hear so much from systems that are trying to focus less on point solutions and more on enterprise solutions. Give us a sense of what you hear from people in that perspective. Are people more focused on trying to do more with a particular vendor versus less? Because everybody's trying to avoid having 1,000 different applications going, 2,000 different applications going. What are you seeing out there, enterprise versus point solutions?
Yeah, I mean, I think, like you mentioned, the consolidation aspect. I think, as I mentioned, some of the big vendors that's where a lot of our organizations are spending their money. Their Microsoft spend, Dell spend, their Cisco spend. But I do think consolidation. I think just having an understanding of what's in your environment, and that's something that SHI really does a great job of helping our customers do. Is because we're such a large scale VAR and we have resources in different areas, we're able to be very vendor agnostic with the solutions that we recommend, that we provide to our customer base. So, I think, like you said, more and more people are trying to lean more toward consolidation and just having a general understanding of what they have, what are their needs, what are their business initiatives, and then kind of, narrowing down the solutions from there and having less to manage. I think the less you can have to manage, the better with some of the, I don't want to say skeleton crew type of IT staffs that a lot of hospitals have, but, the reality is that everybody's really stretched thin. So I think the more that you consolidate, the more that you can consolidate and understand what you have in your environment, I think the better decisions you'll be able to make for your organization.
And let me ask you a question, and this might be a very complicated question, and you don't have to answer this if this is too personal or too challenging, okay? Let me know. Here is the question. If somebody had to pick one driver this year to take with them to the golf course, what's the one driver that you would recommend?
Scott, have had the Srixon ZX7 in my bag for a couple of years now. They just came out last year with the Mach 2 ZX7, which I've heard is great. I have the previous generation in my bag. I am hearing a lot of great things about the new TaylorMade driver, though. I got to say, it's obviously I think it's the QI10. It's called. I've heard some good things about it. I got to say, it looks fantastic. I was a TaylorMade guy before Srixon, but I've had really good results with the ZX7. What do you have in your bag right now?
Well, right now I have got oh my goodness, what's in my bag right now? I've got a Ping, a G430, like a very much a very easy to hit, very much club improvement, the game improvement, very easy to work with. I've worked with the Paradigm Triple Diamond. I've gone back and forth on that, but I've gone back to the Ping because I'm just having an easier time putting it where I want to be and being in play, even though it might not maximize the yardage that the Paradigm does. But I did notice on your bio that you've got a serious golf background, thus the golf question. So thank you for indulging me very, very much. And it's, it's a constant struggle.
Yeah, it is, and it's funny you mentioned that. So I've been playing golf a long time, but I just joined a country club in New York, so this is my first time going to be at a private club. So I am really looking forward to the golf season, being able to actually practice whenever I want, play whenever I want. It's I'm hoping that my short game turns the corner a little bit this year.
No, I wish you luck. I'm one of these persons who's never found a club who doesn't think it's going to be the answer and then find that it really isn't. That there's a great quote in golf, and it's so true in business. The business, and I hate people that compare business to golf, but I'll tell you this. There's a great quote from Bobby Jones, famous golfer, that says, the most important club you have or instrument you have is the 5.5 inches in your head. That's how you think about how you do things. And it's probably the most true statement about golf, and probably the most true statement about business as well. Alex, you're having this terrific career. Talk for a moment about what advice you would give to young careerists, people trying to build a leadership career, try to build a business career. Any advice that you would give to people?
That's a great question. My business idol has always been Steve Jobs. I love what he stood for. I love how he and Woz built the company up. And one of his quotes that always stuck with me as far as leadership strategy is concerned is hire A+ people and get the hell out of their way. And, to me, I still find that to be really true. And, the reality is, with tackling massive change in healthcare IT, with all the different noise that's out there around AI, it's impossible without great resources. It's without great people, excellent leadership in place. So I think, as far as evolving leaders and moving into the future, it's, pick your people wisely, pick your horses wisely, and trust that everyone's going to come through with their part. I think that's a great way for evolving leaders to, take on more responsibility, but at the same time, empower their people and empower their colleagues to help them along the way. Is just hire them, give them the resources that they need to move their career forward, to make proper decisions, and let them do that. And so that's what I would tell any evolving leader or anybody that's progressing in their career, is just, pick your horses wisely and get involved with good people.
No, Alex, I think that is actually fantastic advice. I want to thank you for joining us today on this combined episode of Becker's Healthcare, Becker Private Equity. What a pleasure to visit with you. Thank you very much for joining us today.
Pleasure. Thanks so much for having me on, Scott.
It's so important for leaders at the top of organizations to keep learning, stay sharp, grow their networks. To help our audience better do this in a more simplified, personalized, and meaningful way, Becker's Healthcare has launched MyBHC. It's your trusted Becker's healthcare experience and more, with content, connections, events, and learning opportunities. Join the community free of charge at www.my.beckershospitalreview.com, and we'll see you there.